Hi, I'm Ben McClintock, the co-founder of Defending Utah at defendingutah.org. I've been involved in the liberty movement for many, many years. For over a decade, I was the Western States Director for a national liberty organization and featured in many regional and even national publications. In addition to Defending Utah, I also run a chicken ranch. In pandemics of the past, there was no questioning how serious it was because it was self-evident. Hospitals were overrun. Death hit virtually every family. No one was left unaffected. However, with COVID-19, there are mass movements with protests, news reports, and mass refusal to comply with government mandates. Now, what's the difference between people voluntarily taking precautions versus so many people questioning the official narrative? In 1793, the Philadelphia yellow fever outbreak killed 10% of the population. People chose to isolate themselves because the danger was obvious to any observer. Even the capital of the United States was moved out of Philadelphia because of it. For 30 years, the United States faced a cholera outbreak from 1832 to 1866, killing upwards of, again, 10% of the population. The people were able to observe its effects and willingly took steps to ensure the prevention of infection. No government intervention was needed for the people to do what was naturally obvious. In 2009, the H1N1, or the swine flu, is said to have killed almost 300,000 people, with upward of over 1 billion suspected cases. Even with these statistics, the response of governments worldwide was nothing compared to what we are seeing with COVID-19. These were clear and obvious threats to the public health. However, the current purported pandemic has killed 0.0005% of the population. However, even that percentage is seen to be high by many, since the CDC counts people that died with COVID the same as if they had died of COVID, with 96% of that 0.0005% now being called into question. From the very beginning, the White House was admitting estimates were drastically overstated.
I'm sure many of you saw the recent report out of the UK about them adjusting completely their needs. This is really quite important. If you remember, that was the report that said there would be 500,000 deaths in the UK and 2.2 million deaths in the United States. They've adjusted that number in the UK to 20,000. So 500,000 to 20,000.
Another cause of Americans questioning the official line is the change of messaging. From the CDC telling Americans not to get masks, to everyone being forced to wear a mask, and now certain masks are actually worse than no mask, according to the CDC. Add to that the mantra of flattening the curve to return to normal being replaced now with the idea of a new normal, only coming when a large portion of the population gets a vaccine with limited testing, government safety precautions suspended, and no track record of long-term effects. With an ever-changing goalpost and a threat of never returning to the way things were in February of 2020, based on a virus with death rates far lower than previous pandemics, people are starting to wonder, what's really going on? You are not alone for questioning the mainstream narrative. It's okay to ask questions. It's okay to demand answers. It's okay to demand your rights be preserved. It's okay not to be satisfied until the answers make sense. If you like these videos, we are doing more and going more in depth into these topics to help us to better understand what's really going on, to help you know what questions to ask and how to stand up for your rights. Subscribe to this channel, share this video with others. Make sure that your elected officials understand what's going on and that it will not be tolerated that your rights continue to be stripped away. Until next time, I'm Ben McClintock from defendingutah.org.